unit is being set up in the Western Cape designed to identify and come up with new ways to fight violent behaviors in suburbs and towns across the province. Premier Alan Winde revealed this in his State of the Province address, claiming it's a first for South Africa. To explain the Violence Prevention Unit's work, we've got the Health Department's Director of Intelligence, Melvin, live with us now. Thank you so much for joining us, Melvin. Let's start off with the MO of this unit. How exactly is it going to operate? And why is the Health Department the right unit for this to be housed in?
Okay. Good morning to Fuma and good morning to the listeners. And thank you for giving us the opportunity to speak to you today. So the first question is, why would you have a violence prevention unit in the Department of Health and not in one of the security departments? So I think there are three reasons for it. The starting point is to understand that the Department of Health is on the front line of dealing with violence. And as a consequence, we have access to very rich data sets. So if there's an alleged homicide, we have all the information on where the alleged homicide occurred, when it occurred, and the mechanism of injury. If a person is injured and they come to our health facilities, we have all of that information. And if we pick someone up through our government ambulance services, we have that information as well. And the Department of Health has the ability to integrate that data to generate intelligence and reports, which we can give to our security services so that they can use it for resource deployment, strategy, and operations. So I think that's the first reason. The second is that the COVID-19 experience has taught us how to use research, evidence, and data in order to set up strategies and policies and operations in our fight against COVID-19. And what we're hoping is that we can take those learnings and apply that to violence prevention. The third reason, and perhaps the most important, is to understand that while the unit will be placed in the Department of Health, it's a collaborative unit. So we will be working with all of government and all of society to reduce violence in the Western Cape. Now, in terms of what the unit does, there's three sections to it. There's the evidence and data section, there's the strategy and policy section, and there's the implementation support section. So we will be using all of that, working together with our various partners in government, particularly what we call area-based teams, to decrease violence in local geographic areas. I think the key principles we have to follow on this is that it's going to be a collaborative approach and it's going to be a public health approach.
We'll get to that collaboration in just a few minutes, Melvin. I want to find out how this data that you collect is going to be turned into an effective strategy, because collecting the data is one thing, but actually implementing an effective strategy is a whole different story.
Yeah. So the first thing is to understand how the data is collected and what advantages we have in the Western Cape. And we're very fortunate. So many years ago, we put an investment into something called a provincial health data center. And we put an investment into getting electronic or digital information. So what our provincial health data center can do is that it can draw information from multiple different information systems, your X-ray system, your pharmaceutical systems, your laboratory systems, and even clinical reports, and pull it together and integrate the information. And then from that, we can generate reports and do analyses. What that does is it gives us the ability to understand where violence is occurring. It allows us to understand what type of violence is occurring. So for example, I can tell you that there are certain areas where knife injuries are far more common than gunshot injuries. We can also determine when the injuries are occurring and what groups are more affected by injuries in certain areas. Now we're hoping we can take that information, give it to law enforcement, give it to our partners in the area-based teams so that they can carry out interventions. Now, already we've done one intervention where we looked at the times when violence was occurring, and we realized that it was occurring particularly over the weekends, particularly after Friday evening and over Saturday and up to Sunday morning. And so these special groups of law enforcement officers called LEAP officers then changed their deployment times to align with the times when the violence was occurring. So what we're saying is, let's look at data, let's look at evidence, and then let's change our execution based on the data and the evidence. Of course, we want to do it in a much more detailed way, because we want to have a meaningful impact on violence, because that's what our public wants. And that is what our intention is.
Melvin, this is going to be a huge ask. It's going to require hospitals. It's going to require law enforcement. It's going to require community-based groups. How are you going to make sure that all of these stakeholders are aligned? And is this not going to put more pressure on departments like health and law enforcement that are already stretched?
So I think we've got to start by looking at the pressure our public is under, and the pressure that people are under in their daily lives when they are faced with violence, when they're hearing gunshots that are occurring. Then you have to understand, and it comes across in the Premier's State of the Province address, that we must do something. There's a sense of urgency to do something. Yes, it will put us under pressure, but it is something that will add incredible value to the lives of the people of the Western Cape. So it is our responsibility to address it. Now, how is it going to work? It's not going to be easy, but we've already started this collaborative approach. So for more than a year, the Department of Health has been working with the Department of Community Safety in a joint project, a joint collaborative project on the Western Cape Safety Project. But it doesn't just include health and community safety. Social development, the economic development in tourism, education, they all have a role to play in violence prevention. And so what we're going to do, it's not going to be easy, but we've already started the process of a collaborative approach. And we've said to ourselves, dealing with violence cannot be given to just one entity. And reducing violence is not just about law enforcement. It does require law enforcement, but it also requires addressing all of the factors that lead to violence and making a meaningful difference to reverse that, so that we can create a safer community in the Western Cape.
Melvin, I've only got a few seconds left, but very quickly, when is this unit going to be fully operational?
So we have already, the data component is already established. It is necessary to get the policy and the implementation support units up and going. I cannot give you an exact date. We are still in the formation part of this unit, but we do hope to have it off the ground as soon as possible. I will soon be able to give you a more definitive date on that.
All right, Melvin, thank you for your time. We appreciate it. The Western Cape Health Department's Director of Health Intelligence, Melvin Moodley.